medication management can get complicated kind of quickly, particularly after an ER visit, hospitalization, new diagnosis, or medication change.
And joining us today from Interim HealthCare of the Upstate and the Midlands are Brooke Meeker and La-Shina Jones. Thank you so much for being here, ladies. Appreciate it. Got that interim red on.
That's right.
We always love it when you're rocking that. And this is such a great segment. We have a lot of viewers that are trying to manage medication, and back to school is a good opportunity to say, let's educate you on how to keep that less complicated, keep it organized. Well, starting off, what advice would you give to folks when they're trying to manage all these medications? And it seems like a lot to take on at one time.
It is a lot to take on at one time, and there are definitely multiple barriers, and barriers that could include visual, cognitive, having tremors, and then family members. We highly encourage keeping an updated medication list, because one of the number one reasons for rehospitalizations is that mismanagement of medication.
Yeah, the list is important, because I never thought about putting I was just on vacation. I never thought about even making a list of medications in case I'm in a situation in which I can't speak for myself.
Right.
Which is important.
And you want to make sure that also the patient, a lot of patients utilize my chart, so I tell them when they go to their physician office, get a printout of your medication list. A lot of organizations do not use my chart, so you want to make sure that they have that medication folded up in the bag and take it to their provider that's not, so they can see what other providers are like. She said that a lot of patients see multiple physicians, going here and there, and they are not realizing, oh, I ordered this, but another doctor discharged that, so you want to make sure. But one of the biggest problems I see in home health is the patient. You want to make sure that medicine is their medicine, not the husband's medication. You want to make sure they are taking the right medication, the route, and not putting eye drops in your ears. You want to make sure that they are taking it at the right time.
And remembering too, sometimes, I have to take one pill in the morning. And you know how many times I'm like, even though you have the same routine every day, but you're just like, oh wait, did I take it already? And that could be real bad.
That can be very bad, and we do utilize, La-Shina will show us, we utilize.
This is a pill planner. One thing we do is this one right here goes from Sunday to Saturday.
Okay.
But the biggest problem I have is when a patient will say, hey, my mom has to get this thing filled and I have to work. What should I do? They can fill this, and sometimes I give them 2 so they can have the 2 weeks, or I even recommend them purchase a 30-day pill planner. That way, if the children have to work out of town, mom and dad still have their medicine filled for that whole month.
And look, I want to show it to our viewers. No, you're good. Look, all you have to do is you know what? You put that one in the morning, your Sunday.
Noon.
Yes.
And we also utilize these 2 items that is very, very, I love it. And I start a care book when I'm talking to a patient. They have multiple medications. Some of the medications are old and new. So these mean no. That means do not take it. That medication is old. I'm going to take it and I'm going to put
We get in that home sometimes and find out they have a whole cabinet of old medicines that they're not willing to get rid of.
Yes, right.
You think, oh, I might need that, but it's expired. It could interact with something that's
so it's helpful to put it in the red bag.
Red bag means stop, and this green bag is all of their medication they're supposed to take daily. So this is very helpful.
Simple as red and green.
And you have a little test too to show us, because sometimes we're like, I don't understand why it's so hard for my mom to take her medicine. You say, okay, you try to do things. So the gloves kind of replicate
So this will show us how we have barriers with if we have tremors or cognitive issues where we're not able to pick exactly where we want to reach.
Yeah, it already feels, we're just trying to pick up.
And let me see that. She put my medication.
You get to
wear the glasses.
You get to wear the glasses. So,
and the glasses are going to...
Whoa!
And then I try to pick up one out of the pill planner.
Yeah, so try to pick one out of there.
Okay.
So this is visual issues. It could be macular degeneration. It could be
Kind
a
of
multiple...
Yeah. See?
All right, got one.
And I can't even,
Yes.
And that can be difficult.
They can.
In trying to open up
a pill bottle.
Yes.
Yeah. So
it's hard enough opening these things with
For
normal
real.
hands.
That's right.
I can't imagine.
These are great resources too, great ideas and things people
It helps to just educate. We educate providers, facility staff, the families, so that they understand those barriers. Because sometimes you just think, why is my mom not just taking
Yeah,
the
just take a
meds?
pill, it's easy. Yeah.
And that's where that med management program is so important, and it can be ordered by any provider that has the ability to write that prescription and get home health involved, and it can stand alone. So
Yeah.
it's a program that can stand alone.
Education is such a big
amazing.
part of what you guys do. So
Yes.
if you want to get in touch with Interim, you can go to the website, which is on your screen, interim.com. You can click on the upstate location or the Midlands, depending on where you are. You can also call that number on your screen. They're always there when you need care, so be sure to check them out. Thank y'all so much.
Thank
Really
you so
appreciate it.
much.
Thank you for
Great
having
Great
us.
visuals.
Yeah,
So
for
good.
sure.